I'm Lori. I'm from San Antonio, Texas. I have 3 rambunctious girls. I love being a mother. So we were trying for 8 years and had pretty much given up. I visited the hospital because I was having pains all day. Did an ultrasound thinking, oh, I just have a cyst or fibroid or something that was very normal to me, and was told I was 5 weeks pregnant. It was a miracle. She told me I was gonna be a high-risk pregnancy, more than likely was gonna have gestational diabetes, but she had a plan in place even before we got started. Just from one look at me and just one look at my history, she immediately assigned me to a fetal specialist. When I hit right into my 2nd trimester of pregnancy, my blood pressure started to go up, and I immediately called the doctor's office. I wasn't scheduled to see my doctor for another week, and I called her and they said to come right in because my blood pressures were a concern. So at about 19 weeks of my pregnancy, I started to feel a lot of pelvic pressure as if something was gonna fall out, and really freaked me out. I was also cramping a lot, and my blood pressures were really starting to creep up. They did an ultrasound, and I was actually already going into labor. My baby was already trying to come out at 19 weeks. Scariest moment of my life. I was in the hospital about 7 times before I delivered my baby, and it was all because of my blood pressures and the gestational diabetes. I had headaches, I would feel dizzy, I would get really winded even sometimes just walking to the bathroom and feeling like my heart was gonna come out of my chest. At 32 weeks, I woke up in the morning and sudden rush of pain directly to my head. My blood pressure was sky high, and I thought, no, this can't be right. I hadn't felt my baby move for an hour and a half by the time I'd got to the hospital, and that freaked me out even more. As I was sitting there in the bed, heard her heartbeat, I just felt so much relief in that moment because at least I knew she was okay and it was just me. Then I got the most excruciating pain at the top of my stomach. She yelled for the doctor. They didn't even have to call her because she was already running into the room saying, "That's it, we're doing it right now. We're taking her out." After a few minutes and feeling some tugging, my daughter came out full screaming. So I couldn't stop crying at that moment. My doctor basically told me that she's happy I listened to my body because my uterus was about to tear. So it was so paper thin at the top. She said I would have bled to death had I not paid attention to what was going on and had they not been watching me so closely. I had amazing nurses to lean on. When you feel something's not right, don't take the advice that it's normal, that it's a part of pregnancy. Listen to your gut feeling. Ask the questions. It could save your life. Hear Her, Texas.